Hello everyone, my name is Katie, and for my mock evaluation, we will be evaluating Mary, who is a new ICU nurse, and she is enrolled in our yearly unit competencies. The competency that we will be evaluating today is a wet to dry dressing change. At the beginning of the course, Mary and the rest of the nurses were given a guideline with step-by-step instructions on how to complete the dressing change properly. Mary understands that she will be evaluated on the 3 domains of learning: cognitive, affective, and psychomotor, and this will be reflective in her evaluation. I have provided a safe learning environment and a positive atmosphere to give Mary her evaluation back. This will be informal, and we will be debriefing the steps and providing feedback to Mary. According to Billings and Halstead, debriefing of simulations provides students with the opportunity to further reflect and cement their learning. 3 criteria will be evaluated addressing each of the domains of learning. The first criteria that Mary needs to meet is the nurse will describe the proper list of supplies needed to perform a dressing change without assistance of the instructor. This addresses the cognitive domain according to Billings and Halstead, as she provides cognitive knowledge through explanation of needed supplies. The second criteria that will be evaluated is that the nurse will accurately perform a wet to dry dressing change in the simulation setting. This addresses the psychomotor domain and provides simulation utilizing hands-on learning and actions of demonstration according to Billings and Halstead. And the third and final domain of learning that will be addressed and evaluated is the nurse will properly classify wound characteristics on paper charting. This addresses the affective domain of classification of wound characteristics according to Billings and Halstead.
Okay, hi Mary. Today we're going to go ahead and do your evaluation of a wet to dry dressing change. I just want to let you know that the checklist that you were provided at the beginning of this course will be what we use to evaluate you at the end. Okay?
Mm-hmm.
All right, and we're going to be assessing your knowledge of all of the supplies that you need, your assessment skills of the wound, and your step-by-step process of performing the skill today. Are you ready to go ahead and start?
I am.
Okay.
Okay, I'm going to start by washing my hands with soap and water, and then I'm going to gather all of my supplies. They include paper tape, clean gloves, sterile solution, an irrigation set, some 4x4s, and sterile forceps. I'm going to prepare my sterile field with all of my supplies. Next, I'm going to wash my hands with hand sanitizer and then apply some clean gloves. I'm going to expose the dressed wound and remove the old dressing with forceps, and then I'll assess and measure the incision. The wound is midline to the abdomen, a surgical incision. It appears pink with granulated tissue with no signs of eschar. A small amount of serosanguinous drainage was noted, and the surrounding tissue appears normal without sloughing. Next, I'm going to apply clean gloves. Next, I'm going to irrigate the wound with sterile solution and then apply sterile gloves. I'm going to moisten the gauze and pack the wound with the gauze. Apply a dry 4x4 and tape to secure the dressing, and then I'll end by doing hand hygiene again.
Okay, Mary, I think you did a really good job. I did see 2 areas of improvement. Before you put on your sterile gloves, you did not do hand hygiene one more time, which is important for patient safety, but that's why we do this skills lab. And then the other thing that you forgot was just signing and dating the dressing so the nurses that follow you know when it was performed and when to do it next. Does that make sense?
It does.
Okay, and how did you feel about your evaluation?
I think you were spot on. I should have done both of those things. It's hard when someone's watching you to remember everything, but I appreciate the feedback.
Right. And what do you feel like you could have had for this skills lab that would have helped you learn more effectively?
I think a video to watch beforehand would be really helpful.
Yes, I agree. I think the next time we do this course, I'll provide a video for the nurses to learn. Okay, well, good job. I'm going to consider this a pass, and we'll see you next time.
Okay.
For my self-evaluation, I'd like to start by explaining the tool that I used. We used a checklist in this evaluation. The checklist was given to Mary at the beginning of her course, and it was used in the evaluation of the wet to dry dressing skill. Each step that Mary took was then checked off of the list and then used in her ultimate evaluation. I think I would do this in the future, but I would also add video recording, as it allows for nurses to watch themselves back and provide their own feedback and correct things on the spot. I was prepared for Mary's responses. I believe this evaluation did go well, and the environment that was initially set allowed for positive interaction and just safety, understanding, and good feedback for Mary to learn from.